So Tugce and I are going to talk about a person with, well, I'm going to talk about a boy with Angelman Syndrome, and she will fill in the important details. All right, so I have a couple of conflicts of interest, which are not really of any relevance. Okay, so here's the young man that I will talk about. So I saw this boy last year. He was referred to me by a neurologist at LHSC. So he's 15. He lives with his parents and younger brother, which is going to become problematic when we look at the family history and you realize that this is actually not correct. But anyway, and he is in a developmental class at a local high school. He was referred because for assessment of both sleep problems and behavior problems. So, okay, so he, which direction am I going here? Okay, so first off, he was diagnosed with Angelman Syndrome at the age of 3, and we'll come back to that. Cognitive testing was attempted but couldn't be completed because he couldn't cooperate and just didn't have the skills, frankly. So on a measure of adaptive behavior, the adaptive behavior assessment schedule, everything was below the 0.1 percentile. So anyway, so he has a long-standing history of sleep problems. So when we saw him last year, his mother said that they will put him to bed between 9 and 10. Sometimes he falls asleep by 11. Often he's not. He's up past midnight. Once asleep, he then will fall asleep for an hour or two, and then he will wake up, and then his parents bring him into their room to sleep. They know that it's probably not good for him and for them, and it's going to perpetuate it, but they said they're exhausted, and so it's the easiest thing to do is just to bring him into the room. Even then, and he will fall back to sleep, but he will typically wake up several times during the night. So he's not getting a good night's sleep, and they're not getting a good night's sleep either. Nobody is really. So he was on risperidone for his sleep from the age of 5 or 6. And then that was gradually increased up to 3 milligrams a day, but wasn't really helping much with behavioral problems and wasn't helping much with his sleep, and so it was ultimately discontinued. At the age of 13, so in 2017, he was started on diazepam as well for sleep. And his mother said she wasn't really sure if that was helpful or not, which I guess if somebody's not certain if it's helping, then almost certainly it's not helping at all. Otherwise, they would be certain of that. And so a few months prior to the current appointment, so this was in early 2019, he was started on olanzapine for his behavior problems, but his mother reported that it didn't help with his sleep at all. So he's been on several medicines specifically for, well, 2 specifically for sleep, one other one that should help with sleep and didn't. And so it continues to be a significant problem. One of the neurologist notes said something about, we have to figure something out in order to keep this family sane, which is not the kind of note you see too often in a medical record these days, but I think it just is a testament to how problematic this was. So on top of that, he also has problems with his behavior. So he will yell and scream a lot, and also has a history of hair pulling, which has been better recently, but still happens at times. His mother reports that sometimes he'll also just give her, like he's getting bigger and stronger. Well, he's not big, but he'll sort of grab her and put her in a bear hug. I'm not sure it's because he's upset, but she sometimes has real difficulty prying him off of her because he's getting bigger and stronger. So he will also, if he's upset, he will, he has a table, what do you call a table attached to a wheelchair?
Tray.
Oh, thank you. He has a tray on his wheel, and sometimes if there's things on, he's upset, he'll just sort of clear everything off. Or if he's at the dining room table, he's upset, he'll sort of clear the table off. He throws things on the ground. Typically, and also a lot of yelling and screaming. And his parents said that's one of the most exhausting things for him because he's just always yelling and screaming. And it's not clear whether it's that he's upset or whether it's for communication or whether it serves some other purpose. But when it does seem to be for, because he's aggressive, it's often things not going as he expects them to or not going as he wants them to, but also sometimes for no clear reasons. His mother said to me it started about age 10, but if you look back, I think it had been a problem long before that, because earlier reports talk about him squealing a lot and yelling as well. Happens multiple times a day, both at home and at school, and so the family finds it extremely difficult to do anything with him, as if they can't go out anywhere because he will start screaming or clear things off, and so they're sort of stuck at home. So the olanzapine was actually started specifically for this purpose, but hasn't really been of any benefit to him at all. All right, anybody want to know anything else about him in terms of what's going on right now?
See, it wasn't walk.
With support. Yep.
Have they tried like putting him to bed at 11 o'clock, like what would happen? Would he still be awake for a couple of hours in the night?
I don't know if they tried. I mean, it would seem logical to try it, just keeping him up later. But I think what they've said is, actually they said he's just more irritable if they don't put him to bed. But even then, he still wakes up in the middle of the night. So it doesn't really
So
have
they're
that much.
happy to get him into bed when they can.
Yeah, I think that's part of it. Yep. All right. So his past medical history is complicated. So at the age of 10 days, he was, what is the technical term for tongue tied? Please tell me there is one. Which is?
Yeah.
So lingual frenulum?
Yeah. Well, that's what they
But
put
it's
it.
but I don't know what the term of
Yeah.
being satisfied.
Frenulum, yeah.
Yeah,
Google
frenulum,
might be
yeah.
able to
So
tell.
it's a
Frenulum,
Yeah, large.
A large frenulum?
Frenulectomy?
Frenulectomy, okay, sure.
Something like that.
I'd rather have that than a
The
little,
actual, surgical.
better than the hemispherectomy. So
I guess
he was also diagnosed with optic nerve hypoplasia at the age of 1, and so he's legally blind. He can see, but is legally blind. And also had surgery for exotropia at the age of 3. So he's had a lot of visual problems as well. So at the age of 1, he began to have seizures, and his mom reports that the EEG was normal at that time. I couldn't find the original EEG. Actually, it's not on Howard, I don't think. But then at the age of 2, it's a bit vague from the notes, but it sounds like he had 8 seizures, and one of them was for 20 minutes. There's a whole bunch of notes with a bunch of different people describing what happened, so it's not entirely clear. And at that time, so he was hospitalized for a week, I think. His white count was elevated, which suggested that he might have encephalitis, but they never identified any pathogen at all. So it's not clear whether or not he had encephalitis. But he continued to have. Yeah, I'm CSF. Sorry, yeah, I think it was, yep. And so he continued to have myoclonic seizures and was diagnosed with myoclonic epilepsy. And I think that his mother and the neurologist described at least 2 seizure types. So he has absent seizures and drop seizures, and may have tonic-clonic seizures on top of that. What the neurologist also said that he had dysmorphic facies suggestive of trisomy 21. And referring to genetics, he was started on clobazam, which reduced his seizures, but created more sleep problems for the family. He was later tried on valproic acid and then on clobazam and lacosamide. Those are the only 3 actual anticonvulsants I've ever seen these, like I said, he's ever been on. Well, other than diazepam, but it wasn't used as an anticonvulsant for him. So when we saw him last year, his mom said his seizures were improved, but they were continuing. And if they're improved and he's still having seizures 10 times a day, that improvement is a relative term in this case. And his drop seizures are 3 to 4 times a week. And one of the concerns that the neurologist had was that if he is up and walking about, he has a drop seizure, he's going to fall or hurt himself potentially if there's nobody with him at the time. So that's the neurological part of his history. Yep.
Seizures started at 2.
1.
1 and
Yep.
behavior, the screaming and stuff. When that was 3.
Mom said 10, but looking back, I think there were reports earlier on his chart. I couldn't find, I mean, the earliest note I had that I could see was from when he was about 2.5, and it wasn't really mentioned there.
Okay.
And, when you ask if you can walk, it's remarkable that reading through most notes, nobody comments on that at all. Because, I mean, the cardiologists don't, and the ENT people don't, and lots of people don't comment on it at all. So.
The neurologist doesn't see what
I think the neurologist, but the cardiologist definitely.
Well, occasionally a neurologist did, but not often. The person who commented the most was a geneticist, actually.
Shocker.
Okay, so he was seen by genetics at the age of 3, and his growth parameters have changed since then a bit. I don't know if any of this stuff is particularly meaningful.
I think head circumference.
Well, head circumference for sure.
Less than third.
Yeah, it's less
and
than
that his ears were large, not just because his head was small, but
Yeah.
his ears were actually large, and that the flat occiput, the rest, and I will go through these, very, very typical.
And she also described midfacial hypoplasia, prognathism, which is an overbite.
Yes,
Or,
underbite. And she said he has an open bite.
Yeah, what's an open bite? I thought that was a typo.
So he just keeps his mouth open basically most of the time, and his
So is
lower
that
chin is like protruded. It's an open mouth kind of.
But don't you have to close your mouth to have a bite?
But is he low tone overall?
Yeah,
Yeah.
yeah, definitely hypotonia, and just again all part of the.
So it looks like a mouth breather.
Probably.
If his mouth is open all the time. That's actually should be that for your next staff picture or something. Also his corners of his mouth were downturned and his tongue was often protruding. Vicky saw him and warned about the possibility of Angelman syndrome. So he previously had a karyotype which showed that he had 46XY. They looked at the ends of the chromosomes to see if there were any abnormalities and found nothing abnormal. I think probably because of the sleep problems, she looked to see if he had Smith-Magenis syndrome, which he doesn't. But I don't think he has the facial features really.
No, they were done all before Vicky.
Yeah,
so.
yep. And then ultimately they did fish for Angelman or Prader-Willi syndrome. So I guess based on that, just on the genetics, you can't say whether it's Angelman or Prader-Willi because we'll just say that one was missing. But based on the clinical features, he was diagnosed with Angelman syndrome at the age of 3. So also has problems with constipation, for which he's actually been hospitalized, and has been followed by a gastroenterologist. He's had pneumonia several times, multiple ear infections. Saw Tim Carey, I think, several times because of braces and support for his legs. He has sialorrhea, so he drools a lot, and was prescribed ipratropium. Is that standard treatment for drooling?
Better now, some success rather than coming out of Parkinson's stuff, so easier to find. You just use the puffers.
So it's better than the Parkinson's stuff?
No, so they're extrapolating from Parkinson's literature where.
Oh, I see. Okay. So an anticholinergic, so
Yeah.
would benztropine work there? But I guess you get all the other
Yes,
you get all the other systemic side effects
that's
of that
right.
also.
Yeah, just trying to get something that is
Localized.
helpful without all this.
So did Botcha do Botox injection actually work?
Yeah.
Anyway, so he had a brain MRI of his brain when he was younger, which was normal. His hearing test was tested and was apparently normal, although I'm not sure how accurate that would have been given his cognitive abilities. Okay, so and then currently we saw he was taking lacosamide and clobazam. I don't know if the dose of those are particularly high or low or anything.
Good dose of clobazam,
He had been on 20 twice a day at one point in time.
which can be activating. So
Yep.
it's the-
Well, and that's what it's, I think Simon, well, the neurologist had said earlier on. But I think the difficulty was it was either seizures or don't sleep. And that was, I think, the choice. So he's also taking diazepam and olanzapine and PEG. What else would people like to know about his history? At least his medical history. So it's very complicated. I mean, as a kid, he's had a lot of problems and had countless visits to physicians over the years.
Are the medical history pieces typical of Angelman's? So it's not that he's got Angelman's and this complicated medical
The
history?
only thing that kind of stood out to me was the optic nerve atrophy.
Mm-hmm.
Other than that, everything is the sleep problems, the constipation, the behavior problems, the seizures.
So he also
the
saw Cheryl
hypotonia.
Clarkson actually about, I think it was on Mickey's Puppet, I can't remember, about whether or not something was pressing on the optic nerve and that's why it was hypoplastic. But I think then the MRI showed there was no abnormalities at all. So. Okay, so family history. There's no consanguinity. Mother has had 3 miscarriages. Unfortunately, it's not clear from the record whether those 3 miscarriages
With
well, it wasn't clear if it was with the current father or with her previous partner, so we don't really know. And there's a half brother by the mother who's older without developmental problems, and a half sister by the father without developmental problems at all. And then there's another relative who there were multiple reports about who this person was, and Tugce thinks it is the father's half sister.
father's half-sister,
Yeah, because first, I mean, it says his father has a 6-year-old half sister by the same father, so that. I guess, okay, yeah, that would make sense, yep.
Yeah.
Yep, with lissencephaly. On the father's side of the family, there is a child with lissencephaly, and then a maternal second cousin has been diagnosed with intellectual disability. I will in a second, but it's unclear, but there's some relative somewhere, and it sounds like it probably is the father's half-sister. But it sounds, but when Vicky wrote the note, though, she said that the half-sister was only 6 years old,
Yes,
but if the dad is old enough to have had a previous kid,
it's a half-sister, so, and a paternal half-sister, so it's still possible that his father kind of
there's
married
a big
later.
difference in age,
Yeah.
yes.
But it's possible.
Anything's possible. Pierre Trudeau had a child at 70, I think, so. All right, so lissencephaly just means smooth brain. So people don't have the gyri, and so this is, well, the best I can find on short notice, but so this is what a reasonably normal brain looks like, but over here you can see there's no gyri and no sulci either. And I think it's associated with cognitive delays and seizures and shortened life expectancy as well.
Very
Oh.
severe.
The cognitive delays are usually pretty severe.
Yeah.
When it's.
Like completely flat like that, yeah.
It's that smooth and it's full. Whole brain.
Yep.
So it's significant cognitive.
Yeah, because I guess the total brain volume would be much less then, because you don't have all the extra, or I guess the surface area would be
The
less.
surface.
Yeah.
Well,
Would you like to share something with the class?
It's amazing how people can survive with brains that are so dramatically different, but it's the brain stem which would control all of the life.
There's a boy I see over at LGC who is, I think I'd ask you, because he has a porencephalic cyst. And if you look at his MRI, it looks like his brain is all fluid.
Yeah.
And yet he walks, he talks.
He walks, he talks.
Yep. I mean, he's visually impaired. He uses a cane, but I mean, it's incredible. And he's got this. I mean, I think it might look terrible partly because of the angle that his head was at for the MRI, but it's still like he's got this massive cyst. And he's,
Yeah, and the little cortex he has is functioning well.
yeah, it's quite surprising. Okay, so family history. There's nothing else of any note in the family history at all. Pretty typical family otherwise. Anybody else want to ask anything about his family history?
Part of his mom, so he lives with his mom and dad?
Yeah, they're together now. Yeah. So the half siblings are actually older, regardless of what I said earlier.
Okay, so it's the three of them in the home.
Yes. I think the.
And mom and dad went how far in school?
I think that, well, I was right. I think both the siblings are older. I think the half sister lives with them, but the half brother, my dad, doesn't. I think he's older and lives on his own
So
now.
he is the only child of his parents.
As far as I can tell, yes. But now I have to go back and check that because there's a lot of confusion in my head. Mom, I think, is a hairdresser. I think she played high school. Dad apparently was a disc jockey, and I'm not sure what his education is. No. Okay, so pregnancy was unremarkable. There's no obvious exposure to teratogens. Actually, fetal movement described as being overly, well, there was vigorous or something like that, I think was the word that Vicky used. So there was no concern about fetal movement. He was born at 41 weeks gestation after being induced. Birth weight was 3,100 grams. So he was born with a cord around his neck and he was slightly gray. And when I saw him, actually, Mom said she thought he was dead when he was born. But pediatrics involved, they actually didn't have to resuscitate him. Well, they might have had to, I was going to say shake him, but I guess that's not. Yes, stimulate him. Gently, not vigorously. And yeah, so he didn't require anything beyond that. And so Mom's first concern beyond that was the age of 6 months. So he wasn't developing, at least his motor skills were not developing. So he wasn't even holding his head up. He didn't sit till he was 12 months of age and began to cruise at 2. But when Vicky saw him at 3 and a bit, he wasn't walking independently at that point in time. And he walks now a bit, but is really ataxic. And so mostly he gets around in a wheelchair. I think the wheelchair probably helps them for simplicity and also for him not wanting enough. Yeah. So Mom said that he was toilet trained by 18 months, but then he was hospitalized at 2 with seizures and possible encephalitis, although never confirmed. And she reports he lost skills. I'm not sure what skills he actually had besides the toilet training. But when we were talking about this, Mom actually started to cry and said, he's never made it back to where he was before that. So in her mind, anyway, we don't have any corroborating evidence, but yeah, I mean, something had happened at that point in time. Never used any words, and he's in a wheelchair for mobility purposes, as I mentioned, as well as safety, things like that. Anything else you want to know about him developmentally? So he hasn't had a good start to life. Okay, so this actually just showing his, well, first of all, it just shows that people measure weight far more often than they do height. So his weight has been going along here, and he's always been at or about the 3rd percentile for weight. And the 2 times his height has been measured, at least at the hospital, he was at the 3rd percentile also. So he's very, very small.
At least you get that. You know what he still is? Those lovely curved charts. They like scare me.
The ones at the hospital, there are 2 different charts you can use. Right? There's a CDC and the World Health Organization. I never know which one to use.
Girls' house that we use.
Are they actually different?
More updated.
Oh, yeah.
Oh, it's more updated, okay.
Population.
Oh, yeah. Better diversity in the population.
But is that a good thing? Because if different ethnic groups have different heights, I just wonder. So for Moldovans, is there a specific, or any other ethnic group of people? Anyway, so yes, so when we saw him, so his height was below.
WHO, that's all we're gonna say. World Health?
Yeah, I think
Okay.
that Mel last one had wondered about that in SARS and where they were canceling stuff. Who is this group of people? I think he said. But anyway, so his height.
He did.
He did. He said, "Who are these people? I've never heard of them before." So anyway, so his height is at the below the 1st percentile. We saw his weight, and again, we have to take these with a bit of a grain of salt because he wasn't the easiest person to get height and weight on, but he was very small. And his head circumference was at above the 3rd percentile, but again, that's difficult to measure. He's not doing it cooperatively. We didn't see any abnormal involuntary movements, no extrapyramidal symptoms because the Lansky, he was in a wheelchair with a tray attached, not a table. And certainly in the waiting room, he looked up and greeting. Didn't use any words during the appointment at all. He may have squealed, but I'm not sure it was socially directed at any rate. He didn't use any other gestures. He did appear to smile several times at his mother and myself when we were sort of closer to him. And I'm also not sure exactly what his visual acuity is. So he occasionally had to flap his hands when he said he looked at some books by just flipping through the pages, but then when I think his mom gave him a wooden book, he just started to rip it apart. And so she took that away from him quickly. So, what's that?
Like a board book,
All books are
as
made out of
opposed to a
wood.
wooden book.
Well, the wood is a paper though, right? So the, I don't know, it seemed wooden to me. So it was a book of some kind of solid surface that was not paper. How's that? But after about 20 minutes, he began to bang his head. So he banged his head against the back of his chair, but also on the armrest, pretty hard actually. And that went on for a few minutes. It wasn't clear what was happening, other than it was 20 minutes, he had nothing to do. I don't think he has any ability to amuse himself either, which is part of the difficulty. But other than that, he calmed down. He didn't really initiate interactions other than that, and he actually was in his chair most of the time, so there weren't any, even though his mom puts him toys on the tray, he didn't play with them at all. All right, so any other questions about him? We'll talk about diagnosis, then we'll move on to Tugce. All right, so comments about diagnosis.
Did people know about his intellectual disability in terms of its severity? Was that
It's not measurable, I mean, because all we have is an adaptive behavior thing.
right? But did people take that into consideration
When what?
when thinking about him? Because he was referred around the question of autism, right?
No,
No?
no, what had actually happened was he was referred to me over at LHSC, and I think Simon had put a referral here also. And I think then Diane Kincannon went to Judy and said, you know, this boy is supposed to be seeing over at the hospital, but I'm already involved with him, so why don't we just see him here? So probably should have been seen by DDP people, actually. So,
Who's diagnosis program?
Yeah.
Other DD.
I don't really question if autism's ever actually come up, and I'm not sure how you'd even distinguish it in somebody so low cognitively.
Well, I was just thinking, because we had a kid that came in with Angelman syndrome, and that was the question.
And
Well, I think he was so low with it.
Yeah, that's.
Yeah,
well, especially, and not only that, but
But
this
it
kid is
wasn't gonna
legally
change.
blind also.
It wasn't gonna change resources.
no.
Yeah, I'm not sure that his social communication skills were below his cognitive adaptive skills, because I would say one is probably generous for this boy, and so it's been a long time since I saw a 1-year-old kid, so. But it never came up with him. So what other diagnoses do we think about? Well, we know at least one for sure.
Yeah.
He has Angelman syndrome, yes. Yep, what else?
Intellectual disability.
Yep, intellectual disability, probably of severe to profound. And I'm not sure how would you distinguish between those?
Severe, they'd be able to do something with that.
Yeah.
Right?
Yeah, I think.
It's a low bar.
Yeah.
To be able to do something.
No, because that just don't need to go below water, right?
It doesn't go low enough, so it wouldn't matter.
Exactly.
So you can do it, but you can do it based upon adaptive behavior stuff.
Yes.
But all the scores reported was he was below the 0.1 percentile.
Yeah.
But I would think both severe and profound are probably
Are
below the
both below
0.1.
that.
So, and maybe it doesn't really matter. Either way, it's not good.
I don't think there's, like, I have not ever diagnosed, or myself, I can't even, but anybody with profound, I think, is severe.
So don't send them to.
No.
Well, I guess what I've thought at times, and maybe it's not politically correct, I think people who have profound intellectual disability, I'm not sure they have the ability to have significant behavior problems because there's so many other issues.
But then even then, like, you think you were physically disabled children, you can't, if you can't test, you don't know.
But they could be very self-abusing.
Right.
But that would require some coordination of movements, then, wouldn't it?
Correct.
So, okay, so I take back what I said then. So, okay, so we've never, I've seen 1 or 2 people maybe ever, I think, who are profoundly, but it's also a small, I mean, if intellectual disabilities is 1% of the population, and I think that based upon the normal curve, profound intellectual disability, 1% of that, so it's 1% of 1%, so it's like 1 in 10,000 people, so it's not.
Yeah, I'm just gonna say,
Yeah.
there's a whole bunch of them.
We don't really probably.
Sure.
He sounds
Someday.
like he's sort of more profoundly affected than some other.
Mhm.
And then other people.
He has the vision
Yeah.
component too, yeah, for range, but-
Yep.
Which that's inside.
Yeah, and that's a low end of- But then
Um,
you got that.
Okay,
viral stuff
and
minus
in
as well.
fact, I left that out. So it's intellectual disability, Angelman syndrome, he's got myoclonic epilepsy, constipation, cyanoria, DSM-5, it's not called insomnia, it's called the insomnia disorder. And also the visual impairment or blindness or whatever medical
You
terms.
also have to say, post-viral encephalopathy.
Maybe. That's not
But in her
clear.
mind, he lost
In mind.
skills.
Yep.
So it's, just all we can say something, maybe.
But it may also have just been the seizures became much worse at
We
that
don't
point.
know.
Yeah. So loss of
Never-
But
skills.
really,
but,
what did he lose? Because by the age of 2,
No,
all he was
no,
doing
no.
was sitting up and holding his head up. He wasn't even walking.
you said it was toilet training, which I'm not
He said-
sure.
Well, yeah, but it could be time.
Yeah. Or she might put him on the toilet once he peed.
That's what
Like,
I mean, time change.
yeah, but I don't even know that would be recurring.
I don't know.
Okay, so anyway, so we saw, so Diane and Ken actually saw him with me at first, and so she was involved with the family and went to the house, and also Mom was very good about coming to Triple P groups here on Wednesday evenings. And the first time I saw him, and it was clear that his sleep is has a huge impact on everybody in the family. So it's just if we can just gradually increase the olanzapine, as long as he's not having more seizures and things. It actually made very, very little difference to him. And so we cut back on the olanzapine, and off the olanzapine, his sleep was a bit worse, but not a lot. What would you guys do at this point?
His neurologist, so he's only been on those 3 antiepileptics.
Yep.
Has he ever been off the clobazam?
I'm not sure that I have the courage to
No,
suggest that.
we would do that, but just
Yeah.
wondered if there was a period where it was.
He was, and he was only on valproic acid, and I didn't look through all the neurology notes because there's hundreds of them.
Yeah.
But from what it's not clear to me why he was put back on clobazam. I would assume it's because his seizures weren't well controlled. Yeah. But for myoclonic epilepsy, are there any other anticonvulsants that work?
Big question for the neurologist, but I just think there's so many new
Yeah.
ones too that have different side effect profile. Clobazam's an old one that can be.
Yep. And so Simon had put in his note about trying Keppra at some point in time, but as far as I can tell, it's not happened at this point in time. So, but his sleep wasn't worse. So at that point, I talked to him and said, "There's several things we could do. We could think about. I guess you could bump up the diazepam, but he's already taking a benzo, and if that may be activated, it's probably not going to be helpful. That I don't know if trazodone would really help in somebody with this kind of difficulty. So I actually suggested we try him on Nozanan and methyltrimeprazine, and on 25 milligrams, which is it's a pretty good dose for a little kid. It actually didn't make much difference. And Mom said it was a bit better, but not a lot. So we increased it to 37.5, and he's actually sleeping somewhat better now. Still not great, but he's at least probably getting 4 or 5 straight hours now a night, which means they're getting at least 4 or 5 straight hours, but it's not enough for them. And his behavior has been somewhat better, I think, with Diane being involved and with the use of some medication.
Are they connected with like the Angel members in the area? Because I know they have, 15 years ago, they had developed beds specifically for kids with Angelman with like TVs and videos because this isn't a good way to get these kids.
So there was at one point in time, so there was a couple of notes from social workers over at the hospital, because I think at one point in time their respite had been decreased like 2 hours a week or something like that. And then they couldn't find consistent people anyway. But the last note I saw from social work said they were getting 10 or 11 hours a week, which isn't great. But and then he goes to Kids Country Club once a month or something like that, I think, for overnight respite. So I'm not sure about the beds. It's a good question to ask.
Yeah, I was at a conference a number of years ago for Angelman, and there was a really high concentration of kids with this in this area. And
Why is that?
Yeah, that's.
Well, probably because of because of genetics programs here. I would assume it's because of maybe access to services or something.
actually, they actually have the Angelman conference at PVCC, 2003,
Many years ago.
maybe?
Any other comments about our friend Stephen, who's really not Stephen? But
Sure, he doesn't have any signs or symptoms of obstructive sleep apnea
I don't know. I mean,
with his low tone. That's
yeah, I mean, his mom, I don't know. I mean, his mom hasn't said anything about snoring, and I think that he is, and he doesn't he doesn't fall asleep during the day if they can see. I don't know. It's a good question.
Just with the low tone, just
Yep.
bringing him. And has he ever had a sleep study done? This has been ongoing forever.
I think it's been talked about. I just don't know how they would actually do it with him. Because I don't know how he, I mean, I'm not sure how he sleeps when he goes to Kids Country Club.
So that's
Yeah.
the key thing. See, I see.
Yeah, I'm not sure. Probably, I know, but if he slept great there every night, would the people at Kids Country Club want to tell his mom that? He sleeps 12 hours a night here. Sound hard as a rock. I don't know. It's a good question. I'm not sure. I'll have to ask.